Good afternoon, everybody. Today, I will present about the effect of family income on relationship between parental education and sealant prevalence. My name is Danielle E.L. Agley from King Abdulaziz University. Despite marked improvement of oral health in the United States, dental caries remain one of the most chronic childhood diseases. A Cochrane review found that sealant reduced dental caries by 81% at 2 years follow-up. Therefore, increasing in sealant prevalence among high caries risk children is the national health objective. Factors associated with no sealant child can be explained in Anderson's and Andy's context, which is about predisposing, enabling, and need model or PEN model. The health utilization is a function of 3 factors. 1. Demographic and social characteristics. 2. Location and availability of health care. And 3. Person's perceived need of care. In this study, we examine the association between sealant prevalence and PEN factors. Whether our predisposing factor is still modified by income and other enabling resources. We hypothesize that predisposing factors will have the highest productive ability, or enabling resource will have higher productive on persons predisposed to use sealant. Methods. The National Health and Nutrition Examination Survey, or NANES, is conducted by CDC's National Health Center using a complex probability sampling design. We use the data from NANES interview questionnaire and the oral health examination combined from 2005 to 2010. We use the public use files of NANES, so the ethics board review approval was not needed. From 8,275 participants aged 6 to 19 years, some of them were excluded from not having sealant, parental education, family income, and health insurance status. So the final sample was 7,090. Dental sealants as our dependent variables was recognized as present if having at least one sealant in any posterior primary or permanent tooth. PEN factors is used for selecting the independent variables. Our major independent variables is the parental education, which coded as less than high school diploma, and more than high school diploma. And other independent variables are one of the predisposing factors, such as age and race, enabling factors such as family income and health insurance status, and need factors such as parents' perception for child's general health. SAS-Calable pseudons was used to generate the standard errors and confidence intervals. We use chi-square tests to determine if the characteristics of our sample differ from those excluded from our study, and if sealant prevalence differ among our explanatory variable. Our confidence interval was reported at the 95% level. Logistic regression was used to identify the association between having at least one sealant and PEN factors, and also identifying the association between major and other independent variables. Results. The overall results show that sealant prevalence among 6 to 19 years old children in NANES 2005 to 2010 was 32.9%. According to the bivariate analysis table, sealant prevalence was associated with all of independent variables. Higher family income and parental education were independently associated with higher sealant prevalence. But however, the regression logistics show that higher parental education was associated with sealant prevalence only in higher income children. To be explained, the odds ratio of having sealant in children whose parents haven't been versus have been high school graduated was significant, but only in family which had 100% of federal poverty level or above. Discussion. Even though we have three measures of enabling resource, which are income, health insurance, and source of health care, we use income as a primary one, and the other two are considered to be less valid for dental care. The study suggests that 1/5 of the children with health insurance do not have dental insurance, and dental insurance also has lower annual limit. It is interesting that increase in parental education is not associated with increase in sealant prevalence among the lower income children, because these children are eligible to receive the Medicaid dental benefits. Our study has the limitation as we use the cross-sectional study, so it can be considered only as the association, not occasional factors. Furthermore, all of our independent variables is just a self-report with no objective measures to confirm. And the final limitation is the change in the non-examiner type from health technologist to the dental hygienist between 2008 to 2009. Our study suggests that the impact of parental education on children having sealant is greater among the higher income group. So the sealant prevalence should increase by enabling more families to receive the preventive dental service through accessing to dental insurance and supply of providers. This can be changed under the government policy, but some predisposing factors such as the education is hard to change in the short term. But some focus on oral health literacy can be changed in terms of more awareness. And these are the focus of interest in the national level. Anyone have a question? If no, thank you for your attention.